I've noticed is that the neighborhood has exploded. You can't walk a block without, running into a stroller or, someone walking their dogs. And there have been a lot of businesses. And Weill Cornell is a perfect partner for this. You have these families and, companies coming in, and they need physicians. They need access to services in their neighborhood. We'll be able to provide radiology, internal medicine, pediatrics, OBGYN, orthopedics, these services that the neighborhood didn't have.
Our families here in the Brooklyn area have to travel a lot less further than they had to before for those services, and they have the latest technologies available there.
Families that are looking for their care all in one place, it's the perfect setup for them.
It's a perfect place to be, and we're excited for the collaboration and to have them in the neighborhood. World-class healthcare that you can trust.
No matter what area of medicine that you are focusing on, the way to excel is to always focus on how do I provide the best care for this family and for this patient.
The most important thing to me is making sure I connect with my patients. I want to make sure that everyone is comfortable in the room, and I feel that once you have that comfort amongst the patient and the parents, then the discussion flows much easier.
Obviously, for some children, the doctor's office can be a really scary place, but one of the most rewarding things that I hear from parents is that a lot of the time children feel comfortable around me. It makes it more likely that they're willing to come back. They know that I'm a nice person and that I care about them.
And just doing my part in maximizing and enhancing communication is a passion of mine. The more frequent and the more effective you communicate, you notice that the patients are better taken care of.
You want to be able to have access to your doctor.
I think one of the really important things is the parents feeling like they can get in touch with me.
And patients are able to ask more appropriate questions, they're able to understand more what I'm trying to educate them about, and that ultimately that leads to better patient care.
It's really important to have good communication with families and feel like you're accessible.
One of the latest advances that we employ here is the implementation of telemedicine video visits. For situations maybe a full exam isn't necessary, and the parents have been very appreciative, and for me personally it's been very exciting to offer this additional service to our families.
It's a lot more convenient, it's a lot more accessible.
We have a wonderful team of call center nurses, people who can get messages to the physician on call, and be able to make sure that the patient feels that they are not being forgotten, or that just because it's after hours per se, that nobody's looking out for them.
All the physicians and all the clinical staff have the best resources at their fingertips, and then it's our job and our privilege to take maximal use of that.
Patient care always comes first. The biggest part of my job is keeping you kind of out of the doctor's office. Whenever a patient comes in, I think about, how can they be their best selves, and how can we help them on that journey?
My connection with my patients and watching them grow through the years from newborn through college is what drives me each day.
And I'm very proud to say that we're delivering the best primary care pediatrics in the city, in the state, one of the best in the country. It's very easy for me to say that you should come here.